All right, we'll go ahead and start the next presentation. Applying the safe systems approach to project development. Presenter will be Jason Siwula. For the last several years, Jason has served as Assistant State Highway Engineer, where he led the Cabinet's innovative program, working with partners throughout Kentucky and with local communities to prevent serious injuries and deaths on our public roadways. Just recently, in July 2022, Jason was appointed as Deputy State Highway Engineer for project development, working with partners both internally and externally on the delivery of highway projects throughout the Commonwealth. Jason.
I wouldn't clap yet. You don't know what I'm going to say. All right. So first, I'd like to start by making an apology. And the reason I want to make an apology is, as Chuck just mentioned, I was appointed in July. Who remembers when the session submission deadline was for the partnering conference? It was a little, it was a little before that. And so, I submitted this session, volunteered to be its presenter, and then find myself in a new role. And so you guys have had to endure listening to me more than once and more than anybody should, to be perfectly honest. So I appreciate everybody being here today. We are going to talk this morning about the safe systems approach. And I'd like to just begin by asking, so would you please stand if you've ever heard of the safe systems approach or if you know much about it? So please stand. Okay. We have some people standing, maybe some people sleeping, but that's okay. Hey, Jason Blackburn stood up back there and he told me he wasn't coming, and I couldn't blame him. So we're going to talk a little bit about the safe system approach and its application to project development. And it's a really exciting time to be working in project development. We talked some about that if you were here with us in the KYTC Federal Highway session on Tuesday. And there's a lot of things that we've had throughout the conference where we've touched on the safe system approach. So we're going to talk a little bit about that. But, since we do have virtual participants and this is a safety presentation, I'm sorry, I can't resist. I'll just ask, please don't participate and drive. We're going to talk about safe systems. Part of that is safe drivers and safe users of the transportation system. So please, please, please don't participate and drive. All right. So when we talk about safe systems approach, and this is a picture of the Cabinet strategic plan, I'm not going to stay on this slide very long because I've got some more descriptive things a little later. But I want to point out that when we talk about safe systems, there are really, really strong strategic alignment with what we're doing here at KYTC. And over on the left of the last slide, the first sentence is this: a good plan is like a roadmap. The journey is the safest when the roadmap is the clearest. Now, that's an interesting concept. We do a lot of planning here within this community, within the partner community. And when we talk about the concept of planning a trip or planning out where you're going, we just heard about the electric vehicle plan. We've heard about the long range plan. We've talked about TSMO implementation plan. We've talked about a lot of different plans and efforts here at the partnering conference this week. And when we think about this from a safety perspective, the journey is the safest when the roadmap is the clearest. And the secretary said this to me early in the administration, right after he came on board, was talking to me about a strategic highway safety plan. And I thought that was a very interesting concept because really what we're trying to do when we talk about project development is we're developing either plans or we're developing, planning documents or anything like that. What we're really trying to do is provide a clear direction on where it is we're trying to go and what we're trying to do. So, like I said, I'm not going to stay here very long, but when you look at the strategic plan and you look at the values and you look at the goals, the first thing that it says on the value wheel is at KYTC, we value safety first. And this is obviously a presentation about safe systems. So that's something that's easy to say, but strengthening stakeholder and customer relationships is critical when we talk about that from a community perspective or a citizen perspective. Delivering economic opportunities and quality of life. all of these different things that we look at with the strategic plan are things that safe systems touch on. And, over the last couple of years, Federal Highway and US DOT has placed a strong emphasis on safe systems, and especially with the implementation of the bipartisan infrastructure law. And we're going to talk a little bit later about something that happened that was pretty significant in January of 2022 that US DOT and Federal Highways did, and how it kind of springboards us into these types of discussions. But first, I want to take a look at where we are from a safety perspective. So if you recall last year, I spoke a little bit about safe systems at the partnering conference, and I had a slide that looks very similar to this. In fact, it's right after this because I want to point out a couple things. So as of yesterday, you can see up here the first number that's highlighted. There have been 447 deaths that have been reported to us. Okay. Now, and I just want to say that have been reported to us. We have some of the best crash data in the country, and we get that crash data very quickly compared to other states, but there is still a lag. And so we know that there are folks that are not accounted for in there, but 447. So last year, when I gave this presentation, 524 was the highlighted number. Now, so we've had 77 less fatalities reported at this time this year versus this time last year. Now, that's progress. That is a good thing. And as we look at some of these statistics that are on the sheet here, we can actually see that we are on pace to have the best year in the last 5 as far as deaths on the roadway. And that is encouraging news, but that's not the end of the road. And so let's go back to today's information. So when we look at this, so one of the things that I've highlighted here is non-motorized, 60 lives lost, and that's inclusive of pedestrians or other non-motorist categories and bicyclists. So, but down here on the lower right, 54 pedestrians lost this year versus 47 last year at the same time. And as we look at what these pieces of data tell us, and as we look at things that we've talked about at the partnering conference, there are a lot of opportunities for us as we look at the safe system approach, as we look at complete streets, roads, and highways, as we look at different initiatives, as we look at innovations through the Safe Transportation for Every Pedestrian toolkit that we have from Federal Highways, from EDC. There are a lot of opportunities to look at places where maybe we aren't making the progress that we are overall. So I want to point out a couple other things. So today, 177 lives lost due to or in crashes where people were not properly restrained over there on the right, 55% of those vehicle occupants. 55.3% last year, so smaller number, roughly the same percentage. We still have a challenge with people buckling up when they get behind the wheel of their car, when they're in their vehicle in any position. Buckling a seatbelt, that's a really important thing. And so as we continue to look at not only what we do through our projects, but how we do outreach and how we do education and how we do community engagement, this is obviously a very important issue. Another thing that I'll point out quickly is alcohol fatality numbers, okay? And when we talk about impaired driving is not just alcohol, it's alcohol or any impairing substance. So that could be drugs, either prescription, legally prescribed, or not legal methods. And 17% this year, 14.9% at this time last year. And as we look at these things, these are very critical these are very critical items for us to keep an eye on when we're talking to communities, when we're thinking about what that means. I was talking to somebody yesterday, and I just made mention of the fact that if you've never talked to somebody from Mothers Against Drunk Driving, if you spend 20 minutes with one of their advocates, somebody who's a survivor, who's experienced that type of loss, you'll never do it again. It's a very humbling experience to talk to somebody that has had that. And so I just want to say that as we look at this, and we are encouraged by the fact that we have the lowest numbers in the last 5 years overall, there's still opportunities through safe systems and through other mechanisms where we can continue to improve, because ultimately our goal is zero. Thank you. I'm so appreciative, because I would have had to stand up here until somebody eventually answered. So thank you. Now, we talk about why take a safe systems approach. Went through a lot of statistics on those last 2 slides. But one of the things that I always want people to think about and to remember, when we talk about safety, we talk about highway safety, we talk about employee safety, we talk about anything that is safety related. Safety is not about numbers. We measure in statistics so that we can see how we're doing, how we're progressing, areas of opportunity. But it's not about numbers. It's about people. And when you look at this slide, which I want to thank Michael Mabe from the Transportation Center. He made it for me. I saw another state that had done something similar, and I said, hey, I want one of these just as a Kentucky one. And so he did that for us as a part of our strategic highway safety plan efforts. But when we really think about safety, when we think about our customers, when we think about the people that we serve, when we think about safe systems, when we think about complete streets, when we think about any of these things and how they apply, our goal isn't a statistical measure. It's not a number on a piece of paper. Ultimately, our goal is to save lives, because people matter. So I mentioned a little earlier that in January of 2022, something happened at USDOT and federal highways that makes this presentation particularly relevant. And those of you who have seen me present before, you know I'm not a fan of reading off the screen, but I'm actually going to do it this time. So on the right, this is the National Roadway Safety Strategy. So I know that everybody's, hopefully had a good breakfast here at the partnering conference, hopefully had a good time last night and, went out and did partnering activities. So if you've ever looked at this document, if you were aware of its existence, please stand up. National Roadway Safety Strategy from January of 2022. Thanks, Mike Fawn, Ryan Tenges. See, and we do have federal highway folks that are standing up too, because I knew that they knew, so I'm appreciative of that. So the National Roadway Safety Strategy, okay? And this document lays out, amongst other things, how USDOT and federal highway intend to prevent serious injuries and deaths on the system going forward. And there's a sentence in there after the introduction of the safe systems approach, and a lot of the slides that we'll see as I go through and explain the safe systems approach again, come from federal highways as they've worked on this and worked on branding for it. But this sentence in the document says, the department will work to ensure the goal of reaching zero roadway fatalities and the principles of an integrated safe system approach are a part of the implementation of all USDOT program activities that affect the nation's roadways. Now, when we look at that, and I'm sorry, this is really the last time I'll ask, but if you've ever worked on a federal project, could you please stand up? Ever worked on a federal project? Now, this is a project development conference. I really feel like most people in here have worked on a federal project. Okay, thank you. Now, so the reason I ask is because it says all USDOT program activities that affect the nation's roadways. Now, that's obviously our core programs, that's our discretionary programs, and things that affect not only the national highway system, but the nation's public roads. And so if you're familiar with, like, say, the Highway Safety Improvement Program or anything like that, you know that that's meant to be all public roads. And so as federal highways through the bipartisan infrastructure law is looking and reaching out and working, looking to work more closely, not only with state DOTs, but with locals and with regional governments and things like that. As we look at this, what does that mean? And so the title of this presentation is Applying Safe Systems to Project Development. And I want to really encourage you, because we've done a lot of things over time that are safe systems in project development. We've had a lot of these things that have made it into our processes because the work that all of you do is excellent. And as we look at this and we look at how we kind of review what it is that we know, how we consider safety, I think about a lot when we talk about safety. I think about intentionality. Okay. And we're going to go through and talk a little bit about safe systems, but I'm going to tell a story on myself here. So the first one of these is safe road users. Okay. And it's up here in the upper left quadrant, and it says safe road users. Okay. Now we can think about that from the driver's standpoint. And unfortunately, I've talked to several people while I was here, and they said, if I'm ever speeding, I kind of hear your voice tell me slow down or buckle up, don't drive distracted. And I kind of hope that's a positive, but I think it kind of sounds like a negative. But whatever gets you to have those safe driving behaviors, I want you to get to your destination safely. So I'm willing to take whatever that is. But safe road users, and one of the things that it says around the outside is that humans make mistakes. Okay, so don't stand up this time because I told you you wouldn't have to. But anybody in here that has ever made a mistake, I'm going to put 2 hands up because I've done more than my fair share probably. Ken Sperry didn't raise his hand. I just want y'all to know that. Okay, now thank you so much for playing along, Ken. I was really hoping you wouldn't. Now, humans make mistakes. So I'm here at the partnering conference. I've been up in front of many of you many times talking to you about making sure that as you're a pedestrian, you're doing safe behaviors. And so what do? As I'm walking with a group, and I'm talking, and I'm turned this way, and I'm walking, and I start to cross with a group against the ped signal. Now, somebody who was with me asked me to turn around so that they could take a picture of me, and they didn't. And I was thankful, but I also told them I can't really live with that type of guilt. So humans do make mistakes. I tell you all the time, I make mistakes. I crossed against the ped signal when I was walking to dinner on Tuesday night. Humans make mistakes. Now, why is that important and relevant to what we do? When we think about human behavior and how it interacts with the facilities that we design, build, construct, plan, humans are going to make errors. Now, that's different than folks that decide to make choices that are unsafe, and those are 2 different things, and we won't go into the psychology of that. But people are going to make mistakes, and when they do, we don't want them to pay with their lives. I actually had a boss that was fond of telling me that about shouldering. You remember who that is, right? Yeah. So we don't want for people to pay with their lives for making an error. Okay. And so as we look at what we do in the realm of project development, as we look at what we do in construction, as we look at what we do when we maintain and operate our roadways, humans are going to make mistakes. And that was a mistake that I made, that I freely tell you. And afterwards, because I shied away from the picture, and I said, what, I really wish that you would have taken it, because I would have actually put it in this presentation, because it's one of those things where nobody's perfect, and I'm not up here trying to preach to you about doing those things. I want you to make those safe choices. And so, but humans do make mistakes. We don't want them to pay with their lives, and that's a key cornerstone of the safe systems approach. So safe vehicles. This is something where, if you look at, NHTSA and the area of their work that does crash testing and safety ratings and these types of things, vehicle safety features are something that, are continuing to come online in this age of innovation. So who can tell me what a vehicle safety feature is? Seatbelt. I like it. What else? Airbag. Okay. What else? Smart cruise. I like that. Lane assist, ABS. What else? Bluetooth, turn signals. Anything else? Seatbelt tensioner. Now, one of the things that wasn't mentioned that I'll just make mention of is the backup camera. Okay, and so if you've bought a car in the last 5 or 6 years, late model vehicle, it had backup camera in it. Now, you think, well, that's not really a super prevalent crash type where people are backing up and that's causing severe injury or death. But unfortunately, those are very familial things when they happen. It's someone, backing over a loved one in a driveway or something of that nature. And so, when you think about all of those safety items within your vehicle, I'm going to ask a different question now, and I don't want any participation, but I'm just going to ask. So has anybody in here driven a vehicle that has some of these safety things and thought, man, that's annoying. I'm going to turn that lane assist off because it keeps beeping at me because I'm not going over the line, but it's beeping at me and I don't like it, so I'm going to turn it off. My mom told me that. I told her to turn it back on. So she also said, well, it beeps at me when I speed. I was like, that's good. And she said, I don't want it to do that. I said, then don't speed. But, there's a lot that goes into that. And so when you think about it, safe vehicles. So that leads into the next one, safe speeds. And when we talk about safe speeds, what does that mean? Does that mean, going the speed limit? Does that mean us being intentional as we're looking at project development, at speed limit selection? Does that look like using a more expanded toolkit for looking at speeds within certain contexts than maybe we have typically done in before? The point is that we want to encourage those safe speeds. Okay, safe speeds removes kinetic energy from a crash. If you have a technical background, the less energy, the less likely it is that something bad is going to happen. And when we look at safe speeds, that's not just sticking a sign in the ground. That's not just making a determination. That's how do we work together, even educational campaigns and things like that, to help people understand that. So safe roads, and talk about that in project development. I'll be honest. I really wish that instead of safe roads, that said safe facilities. And because there's more to the folks that use our roadways than just the roads, right? There's more to it. There's bicycle facilities, there's multi-use facilities, pedestrian facilities. There's different things, transit facilities. There's different things that make up our transportation system. And so I'll just say that when it says safe roads, it's looking at that. And so when we talk about safe roads and we talk about the opportunities that we have in project development, there are so many different things that we have looked at over the years, from what does it look like when we design, to the standard in the Green Book or to a different standard? What does it look like to implement new and innovative things within our projects? And we're going to talk a little bit about that in the next session. When we think about safe roads, how do we interact with that? How do we encourage that? And what is it that we can do to partner together, us, Federal Highways, ACEC, and how do we partner together with our communities to help these roads and these transportation facilities be safer? Now, post-crash care, and I'm going to tell another story on myself here. So I was asked shortly before or shortly after I started with the Highway Safety Office, what types of investments we should be looking at making, talking about how to improve crash outcomes. And if you're familiar with post-crash care and you're familiar with trauma centers and things like that, you'll know that when people get in crashes and they are located closer to a trauma center, they typically have better outcomes. Fewer deaths, fewer serious injuries, fewer things that alter lives forever. And so post-crash care is really important when a crash does occur. And so I was asked, what types of outside of the box investments could we make to improve highway safety, that aren't things that we would typically do? And I said, well, we could invest in rural hospitals. You think about in Eastern Kentucky, there's been a lot of rural hospitals that have closed, and there's a lot of different reasons for that. And you think about different things, but I know several of you in here have had either serious crashes yourself or have had family members who have been in serious crashes, and the availability of trauma centers and doctors and all of those things within the shortest period of time is something that really does change outcomes. So when we think about post-crash care and we think about how the transportation network facilitates that, I remember a few years ago I was having a discussion with a district, and we were talking about the necessity for a project. And one of the things was, well, there's not a really good way for an ambulance to access this part of the community. And this is something that we're trying to address with this project. These things are really important when we talk about post-crash care. And so when we think about all of those things, and I talked about humans make mistakes. Humans are vulnerable. So when I showed you the previous slides, when we talked about pedestrian deaths, humans are vulnerable. If people are getting hit by cars at speed, that's not going to be a good outcome. And humans are vulnerable. They're vulnerable outside of their cars. They're vulnerable inside their cars. Motorcyclists are vulnerable road users. Bicyclists are vulnerable road users. Pedestrians obviously are vulnerable road users. Safety is proactive, and I think this is somewhere that KYTC has done a good job. We have tried to be very proactive for safety, and I know that a lot of our partners have as well. And I've worked with many of the partners here in the room on proactive safety items over the last several years that I think that a lot of you were excited to work on, or at least that's what you told me, so that I would quit asking or whatever. But safety is proactive, and so when we look at proactive safety, that is not waiting for a challenge to actually occur if we believe that risk factors are there and the possibility is there. Redundancy is critical. Now, for those of you who have had a loved one, or maybe yourself, you've been in a hospital. Some of you know I have a loved one who's going through a family medical thing, and so I've been at the hospital quite a bit over the last several months. And so when you look at the safe systems approach, that's really a public health approach is the first place where that was really kind of taken off. And so you think about it, if somebody's in the hospital and they say, hey, I'm nauseous, and say, okay, and they tell whoever's in the room, if it's a nurse or whatever, and they say, okay. So the nurse, confirms what they hear, they see what they see, they talk to the doctor. The doctor makes a prescription. The doctor sends it to the pharmacy sends it up. After checking those previous steps, when the medication arrives, it's checked again by somebody who receives it. It's given to the administering nurse who checks it again, goes in there and talks to the patient. Hey, what's your name, date of birth? My name is Jason, and I was born, a long time ago. And, you go through all these different steps because redundancy is critical to ensure that you don't have a critical failure. We're going to talk about the Swiss cheese model, but when we think about redundancy being critical, all of these things work together. It's not necessarily just one countermeasure. It's not necessarily just one design feature. It's not necessarily just one educational campaign. All of these things work together to create the safe system. Danger or death and serious injury is unacceptable. Okay. Now, this is something that's a pretty simple concept, I think, and at the same time, it's a challenging one. And the reason that it's challenging is because the challenge is great. And so you think about it, you've probably seen over the last several years that all over the country, deaths and serious, deaths from transportation-related items are up. And I saw something the other day that said that the life expectancy in the United States is at the lowest it's been for several decades. And you look at, different factors that play into that. But when we think about it, and going back to that safety is about people concept, we talk about it in numbers because we have to have a way to measure. But when you get down to it on a personal level, death and serious injury is unacceptable. Each one of you are going to leave here today. Does anybody live at the Galt House? Okay, so everybody's going to leave here today. There may be people that live close enough that maybe they're going to walk to their destination, but people are going to leave. They're going to go home. They're going to drive. I want every one of you to make it to your destination safely, as well as everybody that you're traveling with. And so when we think about it, death and serious injury is our goal for every single trip, right? You get in your car, you want to get where you're going safely and unharmed. Death and serious injury is unacceptable. So let's look at this concept of the Swiss cheese model. So you see over there on the right slice of cheese, safe driver behavior, vehicle safety, road infrastructure safety, medical response. These are the same things that we saw in that previous slide, but pictorially represented. And so what this slide represents is that each one of those layers, if you will, of protection, each one of those countermeasures, each one of those things helps in a different way address a potential safety challenge. And so, there are places where we don't have safe driver behaviors, and some of these other features help prevent serious injuries and deaths, okay, such as vehicle safety, such as road infrastructure safety, or such as medical response in the event of a crash. So when you look at that and you think about how this works, each thing that we do plays a part in that safe system and how it is that we get to a place where people are making it unharmed each and every time they make a trip. And again, that's not just, I'm going to work, I'm going to school, I'm taking a walk. It's everything. It's everything where you utilize the transportation system. And so when you think about each one of these things that we do as a part of the safe system, that's an opportunity for us to prevent a serious outcome. We're not likely to know what serious outcomes were prevented, but what we are likely to know as we continue to look at data, as we continue to look at numbers, that these things are effective and they are preventing those tragedies from happening. So this is a quick thing when we talk about like what's the difference from a safe system approach to a traditional approach. So, we talk about preventing crashes and we talk about preventing deaths and serious injuries in the safe system. Now, these two things have some overlap. You're thinking about an Venn diagram. So there are obviously crash types that are very severe, and there are crash types that tend to be less severe. And so as we look at these things, we're looking at trying to prevent those most serious of outcomes as we go through our safety programs, as we go through our project development. Improve human behavior, designed for human limitations and mistakes. Now, again, I want to be clear. That doesn't mean just go out there and ignore all of the things that you've learned about how to drive safely or how to operate safely. These things are, they're meant to work in concert. Safe drivers. Control speeding, reduce energy. This is everything from lighter weight vehicles to slower speeds in certain situations to all of these other different types of things. So individuals are responsible, share responsibility. So, I'm just going to ask because I hear people say it all the time. And, if you've ever heard somebody say, well, you can't fix, I didn't say that. Did y'all say that? So if you've ever heard anybody say, you can't fix stupid, the thing that we're looking at is that we do have responsibility to help others and share those responsibilities. And in project development, we share that responsibility. In our highway safety program, we share that responsibility. As roadway users, we share that responsibility. And ultimately, as members of society, outside of our work and all of those things, we share that responsibility as well. React based on crash history, proactively identify and address risks. There are a lot of opportunities out there. And if you think about a lot of the things that you do in project development right now, a lot of those things that we have either standards or we have recommendations on are because they are known to improve operations in most situations as you go through that. And so when we think about proactively identifying and addressing risks, that's something that I think that everybody in this room does a really good job with, and I'm appreciative of your partnership. So we'll talk a little bit about how about how we've looked at safe systems within project development already. So if you've ever heard of DDSA, I know at a previous partnering conference, we did a lot about data-driven safety analysis. This is a key tool because you can't address things that you don't know about, right? So we look at things, we intentionally examine things, and we utilize data to target these investments because ultimately, as it says up here on the screen, trying to save lives. So who, by raised hand, who got to either interact with Keith Lovin, saw one of the complete streets, roads, and highways presentations? I know I did. I didn't go twice, so I can't raise my hand twice. Okay. So a lot of hands up. So as we look at safe systems, and this document's published on our website. This is brand new this month, last month. And when we look at complete streets, roads, and highways, safe systems is one of the very first things that's discussed in here. And the reason for that is because the safe system is a cornerstone, and ultimately, complete streets is described by federal highways, amongst other things, as a safety strategy. And so as we look at, again, our data from earlier in the presentation, what we have here in this manual is a strategy and a toolkit to help us prevent those serious outcomes for pedestrians, as we were discussing. And so as we look at that, and as we look at implementing this, and as we partner with each and every one of you to make this something that we utilize, those opportunities are going to be there, and we're going to be looking to capitalize on them. And so one of the things I do want to point out, and this is a graphic from the Complete Streets Manual, and it says, complete streets are not only found in urban city centers, they are part of suburban communities, knitting together homes and small commercial clusters, driving economic revitalization of historic small town business districts, and connecting rural areas with schools and other communities. And so as we think about what's in this document and its application, one of the things that Keith said in his presentation is we're a rural state, okay? And this manual and the policy that accompanies it is flexible for us to be able to utilize context to be able to make these types of decisions. And our goal, again, is to have a safe and equitable transportation network for everybody who uses it. So I'm going to just walk through a quick, complete streets look at this. So, looking at this Swiss cheese model, there's a lot of different things that you can do for pedestrians, a lot of stuff that I've worked on with folks in this room. But, you could have things like a high-vis crosswalk and a leading pedestrian interval, a pedestrian refuge island, all paired with, a driver safety campaign telling them why it's important to be looking out for vulnerable road users. And those types of things all contribute to a safe system for those users. And that's not only for the pedestrians and the bicyclists, but also for the drivers. And so when you think about this, it's not as complex maybe as it really sounds. It's how do these features that you've been designing for years, and I heard Moses say something about hundreds of years of experience working on the knowledge portal this morning. For years we've been doing this. We've been doing these types of things to make the best decisions that we know how. And this is another tool in our box to help us do that. But as we look at these things, it helps us to get to a point where we're able to prevent those serious outcomes. And so the last thing that I'll ask is that I'm asking for your partnership. This is the partnering conference, 27 partnering conference. I'm not one of the people that can say that I'm fortunate enough to have attended all of them. For those of you who are good at math, I probably wasn't out of school yet when the first one happened. But what can we do? When we talk about safe systems, get informed. Look at that. What does that mean? How might I apply it? Ask questions. Certainly here to help. Get involved. I know a lot of you worked on DDSA, worked on tons of different safety initiatives. I'm really excited when we talk about safety and project development. I'm supposed to announce my biases. I'm sorry, I forgot at the beginning. If you don't remember, I'm Jason, and I'm really biased towards wanting to improve safety. But get involved and get intentional about the example I set. The reason why, and I'm going to call him out, Jasper wanted to take my picture on Tuesday night was because I am all the time telling people to be intentional about the example that they set, and I made a mistake. And I appreciate him calling me out on that because it helps me be better. And so when we think about being intentional about the example I set, I do that. I try to do that. I do make mistakes. But I would really appreciate your partnership in this area as we talk about safe systems, and look forward to working with each and every one of you as we continue to work through all of these programs, whether they be formula, discretionary, community grants, or anything else to apply the safe systems approach to project development. So with that, I'll take any questions if you've got them, and if not, then we will move on to the next presentation. See, Moses is the one that got all the questions, so I don't know if, nobody was just listening or if there's just really no questions, but thank you very much. I apologize. The lights are really tough to read. Yes. So the question was relative to time of day, driving conditions and things like that when fatalities occur. And so that's a pretty complex answer. So I'll point you to a resource. So the Kentucky Strategic Highway Safety Plan, which is available on the Kentucky Office of Highway Safety's website, does a really nice job of kind of going through there, looking at day and night, looking at weather conditions, looking at various other types of statistical data to try and answer that question. The timing varies. There are statistically, there tend to be more fatalities at night than there are during the day. There are various different contributing factors for that, but the Strategic Highway Safety Plan, I think, has a lot of good resources to help us kind of understand that. Anything else? Okay, thank you.